And welcome back to the show. According to the New York Department of Health and Mental Hygiene, a fatal overdose occurs every 5 hours in New York City. Tragically, fatal drug overdoses reached an all-time high in New York City during the COVID-19 pandemic, with over 1,600 deaths per year. Our next guest wrote a book for all those impacted by the disease addiction. Within the pages of the book, addicts, families, members, and enablers, as well as helpers, will find some unconventional ways to combat addiction from onset all the way to remission. Joining us now is the Addiction Clinician at Lincoln Recovery Center at Lincoln Hospital, Daniel Hyden. And Daniel, glad to have you with us.
It is a pleasure to be here. Thanks for having me.
Yeah, I mean, I'm glad to have you talking about this conversation because there are so many people that actually deal with addiction. And I have to admit that I became more and more concerned as the COVID-19 pandemic was working through, because we knew that more and more people were relying on substance abuse in order to make it.
Right. Well, the numbers we're still compiling the numbers in the medical field. But initially, what we're seeing is that addiction did not take a day off. Depression, anxiety based on a pandemic made the addiction rates skyrocket. But what is problematic is that with those skyrocketing numbers, we have people who have not engaged in treatment, who have not come through the doors in regards to getting their addiction serviced.
Yeah. And when we talk about addiction services, we talk about communities that are affected the most. And we know that in the African-American communities of color, they really have high rates of addiction. But in terms of actually going to services, sometimes there's a huge disconnect between the addiction and the services.
Right. Well, in regards to that disconnect, my experience and also the experiences that researchers are compiling is that there's a stigma attached to treatment. And that stigma is often worse than having the disease in the first place. So in regards to communities of color, we have to work on addressing the stigma and normalizing treatment for these substance use disorders and also the mental health disorders.
Yeah. What is let's go through the stigma a little bit about what are some of the stigmas that are associated when it comes to dealing with this?
Well, with many cultures within communities of color, drinking and some form of drugging is normalized, right? And so the seeking treatment is outside of the norm. Seeking treatment is shows or displays a weakness within some of our cultures. Also on the providers and specifically addiction service providers, with healthcare in the state that it's in, we have people who are not qualified to receive some service, who are disqualified in receiving some benefits to get services. And when they do get those services, the services are disjointed and they honestly don't have enough health insurance to cover the treatment that they need. What we need to understand is that addiction is a lifelong disease and it has no cure, but some of our healthcare providers see differently.
Yeah. And so I know you're taking matters into your own hands. You got a book that you've actually written and wrote, I should say, and talk to us about what got you into writing this book.
Okay, so I've have experience and I've been dealing with addiction since my date of birth, since I've been brought into this world. The Sober Addict, it is somewhat autobiographical. It's based on my experience living in recovery. It's based on my work. It's based on dealing with my clients. And it's based on my studies, actually. So it's just a gumbo of understanding or trying to put a light on addiction and what recovery is, what recovery currently is, that is.
Yeah. And so what is recovery right now?
Well, okay. Well, in regards to addiction, and what I try to highlight in the book is that there's a duality to this disease, right? Basically, anyone that's been diagnosed with a substance use disorder, they have 50% of who they are actively trying to kill them. the book is a call to arms because this is such a serious issue. And I make a statement, and it's not an understatement. To enable is to kill, right? To enable is to kill, because people that are inflicted with the disease, again, 50% of who they are is actually them. Most of the clients that I've had, right? 95% of the clients I have, they don't want to have this disease. They don't want to be addicted. They don't want to lie, cheat, even steal. They don't want the overdoses. They don't want the negative consequences that come with the disease of addiction. So there's a duality in many of the clients that I come in contact with. Those that they want to not use, they just don't know how to, right? And so part of treatment is helping them understand and move through the stages of change so they can see that change, and that mental change will lead to a behavioral change. But the duality of addiction is the main concept of the book, dealing with this dual person, because that addiction has no cure. So there's always that aspect to the individual, but there is who they are, who they really and truly are, that's at constant conflict with the
right. And nobody can really understand unless you've been walking in those shoes what it's like to actually reconcile that, right? When you've got this person that I am at the core, and then the person that I've become. And to reconcile who I've become to who I am can sometimes be a lifelong challenge.
Right. And so it's just so prevalent. In the case of DMX, if you listen and watch many of his interviews, he talks about the everyday struggle. And also, if you go back to the interviews of Michael K. Williams, I believe his name is, the actor who recently overdosed in Brooklyn. He was a prodigy. He was a great talent. He also highlighted the everyday struggle, right? So you have this person who has all this potential, and many people, they reach that potential, but they also have this addict. And right now in the field, they're trying to change this term because of it being stigmatizing. But I use it as it's a badge, it's a code of honor. It's something that I'm conquering and something that I'm dealing with. And I teach that to my clients as well. So yes, many of us within the struggle are trying to balance out, have some form of homeostasis, right? Equilibrium between the self and the true person they are.
Yeah. And so as you're having conversations and you're spreading the word and your book is out there, what's the response that you've been getting?
Oh, wow. Great responses. Now, this is the thing about writing about yourself. You have to put juicy personal tidbits in there, but then, you have these clients or past clients who find the book somewhat interesting because they couldn't see that side of me. They could never understand that there's this whole different form of DC Hyden that he's been able to fight back, right? He's been able to put into remission because, again, this is disease. But it's been an interesting ride with the book. And, I definitely want to highlight that on October 7th, I'm going to release the audio version of the book. And so I'm having a celebration, a book launch event in Manhattan, October 7th at 307 West 38th Street. So I'm excited about that. That's the next new development with the Sober Addict.
Yeah. So what was the turning point for you when you said, listen, you know what? I got to make this change and I've got to do better. What was the turning point / the breaking point?
Oh yeah, that's a great question. Okay, so in the book I get into there being no rock bottom, and there really is no rock bottom for those with this disease, right? The bottom just keeps getting lower and lower. They just keep falling through these floors and getting lower and lower like a cartoon. But I definitely believe that turning point for most addicts is one word, it's consequence. The consequence that finally turned me on to recovery and to trying to live a better life was incarceration, right? And so it just has to be, it has to be something that's unbearable for clients per se, right? Something that they are not willing to deal with in their lives. And with me, it was incarceration, right? So straight and narrow since then.
Yeah. I know you got a lot going on. It's all right. We listen. We try to navigate it. So it's all good. But let me come a little bit closer to home. Here in the borough of the Bronx, where our show is based out of, you see a lot of drug deaths. And we don't just see a lot of them. We're actually one of the leaders in that area. Share with me what some statistics that you may know when it comes to the Bronx and drug deaths.
Right. Okay. So the last numbers that we have from the Department of Health and Mental Hygiene, also from the local hospitals, it's just been within the last 3 years, the Bronx, specifically the South Bronx, leads New York City in overdose deaths, right? And specifically with that population, it's Latino. So the Bronx is a place that needs a lot of help in regards to addiction services. But the numbers to me are astounding. How within the last 5 years, it's just back to back to back. The South Bronx specifically has led the city of New York in overdose deaths. And that population, within that population, Latinos have been the most adversely impacted.
Yeah. So how do we get people through the doors? Because we know that there's help available once they come through the doors. And we know the biggest challenge is sometimes how to get that individual into the door and say, listen, this is the best thing for you.
Okay. So we have this modality in the field that's called harm reduction. And harm reduction is providing services to individuals to reduce the harmful use and abuse of their drug of choice, their DOC. Getting people through the door, it's simple. It's enticing them, having that carrot, waving that carrot out, something that's of interest to them to get them in the door. So whether it be clean socks, whether it be clean needles, or whether it be clean counselors, right? We have to do whatever we can to entice this demographic into getting through the doors. And once they're in the doors, right, these issues with the health insurance and these issues with the providers that are paying for the services, we have to fix those as well to keep those clients engaged in services. Because again, this is a lifelong disease. But what we're seeing is that these agents, well, these companies, they're not going to pay for services for a lifelong illness, right? So it's interestingly enough, addiction has lower relapse rates than lifelong diseases such as asthma or diabetes. So it is a lifelong disease, but it's a disease that can be addressed and fought back into remission.
How powerful is personal experience? I mean, the opportunity to come behind the door, hear somebody who's quote unquote been there, done that, and got a T-shirt, right?
Right.
And now I have the opportunity to done that, got a T-shirt, and overcame. What's that? What is the impact that you feel of having people who have suffered in dealing with substance abuse be able to be connected with those who've actually overcome?
Living experience, or what we call lived experience in the field, is a powerful element to address the demographic, right? But that's not the turning point that gets them into the desire, into the stage of change to want treatment. Again, that's that negative consequence, right? And so the lived experience is important when you're working one-on-one with the clients, but the issue is getting them through the door, having them engage in treatment. And so we got to go back to our communities. We got to go back to the families, or who we consider, or who our patients consider as families, and having them normalize treatment, right? End the stigma of getting into treatment. And then we got to end that stigma with the providers and with the health insurance companies, so we can have health equality, is what we call it.
Yeah. We hear a lot of embrace around opioid drug use and those persons who are struggling with the addiction of opioid drug use.
Right.
From a perspective, when you talk about communities of color, we've made this correlation before, that it seems as though when it comes to the opioid drug use, that it's been more victimized, but then in other drugs of choice, it seems to be more criminalized. Can you give us an idea as to communities of color and how much they're engaged in opioid drug use presently?
Right. So the statistics and what we're seeing in regards to the substances that were overdosed, right? It's heroin. It's not generally the opioid pills, which kind of made the epidemic skyrocketed, which was the Caucasian demographic kind of led that. But within the South Bronx and within the other communities of the Bronx, the drugs that they're overdosing are, of course, heroin and fentanyl-laced cocaine and heroin and other opioid products. In regards to the opioid epidemic, it helped the Caucasian demographic because it was addressed to help them. But the funding and the changes in law, it assisted people of color. But I'm one of those advocates that wish that we had the societal turnaround for the crack epidemic, right? In the early 80s and in the 90s.
Yeah. So where does your work go now? I mean, you're out there, you got the book out there, got the audio book going. What you got coming around the corner?
Okay, so I'm at work. I'm always at work, and I'm here. I got a full caseload, so working with my clients, and this is where I love to be, working one-on-one with the people of the Bronx. Also, I teach courses part-time at night at Recoveries R Us, right? And the Recovery R Us is a training program for peer advocates and CASACs, right? That's the credentialed clinician that practices in the state of New York. So I teach those courses as well. I love teaching, and I'm really comfortable where I'm at right now. I am writing a second book, so that's in play. But right now, it's all about the sober addict and helping people to fight this disease, right? This lifelong disease from onset to remission.
How do people get their hands on the Sober Addict?
Okay, good question. So it's available in bookstores. The primary place to get it is on Amazon. So the Kindle or the ebook version is available now. And of course, the paperback version is available. And on October 7th will be the audio book. So I'm excited about the audio book.
Audiobook is awesome. When people have the opportunity to listen and ride and walk and do those things, it's
Yes.
it takes the message out a little bit further. But which was leading me to my question about taking the message further. How can the general public be able to help to take the message further to assist those who are actually dealing with this sometimes deadly disease?
Right, and so I'm big on pop culture, right? So pop culture, you have drug use, you have drug abuse, you have the normalization of drug use, drug selling, and we have to change that within communities of color. That getting your treatment for a substance use disorder is normal, right? And helping a family member who has substance use disorder, it's normal. Like, this is just a normal part of life, and it's something that can be addressed just like asthma or dialysis or cancer, right? And so it really starts with us. It really starts in the home base, and whoever these patients consider their family members, whether it be the extended family, people in their gang, people on the streets, right? The grandparents, the grandfathers. We just, again, have to normalize treatment. And so once we normalize treatment within our community, right, and then I believe we'll see a significant increase in our clientele within these treatment centers in the city of New York. But that's going to be a long process because, again, it starts within our own culture, right? The message starts within us. And so I think, I'm one of those people that's trying to lead the way and preach normalized treatment, because this stigma attached to treatment within community of colors, it has to be broken down. It's a barrier that's keeping us back.
Yeah. DC Hyden, we got to leave it there, brother, but certainly you're an inspiration, and thank you for the work that you're doing to help others. As you said, you got the t-shirt, and now you're helping others put the t-shirt on. Thank you so much for sharing with us. And of course, we got to bring you back and have an opportunity to find out how things are going.
Great. It's been a pleasure. Thank you for having me.
All righty. DC Hyden, our guest here. Yes, The Sober Addict is the book. We encourage you to get it, read it, and bless somebody with it. It just might help them in their very own life. All right, taking a quick break. We got more on the social justice forums, more guests, more conversation right after this.